Okay, this is our banded hip abduction exercise. So muscles, hip abductors are on the outside of the hips. Very, very important for when we're on a single leg, which would be things like walking. We're constantly going from one leg to the other, going up and down stairs, jumping. It's a very important muscle. And just because of how we move every day, unless you're consciously and intentionally trying to work on activating and strengthening that muscle, you're probably not just doing that, meaning everyday activities are not enough to get that muscle strong and maintain what we're trying to maintain for health of our body. So it's the muscle that when you pick up one foot, it is working, one of them, it is working so you don't sit and drop into that hip and it shoots out to the side. So it's keeping your pelvis level. So I have a band here. This is like a medium band. It's just, or light to medium. It's the TRX 5-pound band here. I think it's 5 pounds to 12 pounds. You're going to put this around your lower legs and it has to be above your ankles. Okay. And then you're going to have a wall that you can put your hands onto and press against. Okay. So I'm using that wall. Then what I'm doing is I'm going to try to keep my hips level and I'm just going to send one leg out to the side. You can widen your hands for this just to, again, keep you stable because you don't want to twist. You want to stay nice and straight, squared, pressing out to the side and then back in. Now, both sides are working, but the standing leg really has to increasingly work against that resistance with this leg going out to stay sturdy. So this leg is working to move the band out, but they're working differently. One leg is moving, one leg is sturdy and standing and still. So I want you to focus on that standing leg for this, okay? And you could do this, and first you could start with wide arms, because again, you're counterbalancing. Maybe then you bring your arms in. It's a little harder to stay square. And then you can get to one arm, which I would recommend doing not this arm, but the leg, the same leg that's moving, that be the one that you stay to kind of counter. Okay. You also can do forearms on the wall. And this would be the first one I would try. If you're really struggling with, my goodness, I can't stay square, I just keep twisting to try to lift this leg up, then it's most likely the band resistance has to be a little bit lighter, or drop down onto forearms so you can really activate your trunk, which is your core muscles on the front, the sides, the back. They'll automatically do that when you're on your forearms. Okay, it's going to put more demand through those. That might help you be able to isolate and stay square as you're pressing that leg out to the side.